Hello and welcome to another episode of The Time with a Specialist Dental Edition on HealthAfrik. This program is brought to you by the Association of African Universities, AAU, and my name is Isabella Tese Ahinakwa. In today's episode, we'll be discussing with our resident guest one of the common dental diseases that affect millions of people, and majority are unaware of the risk and consequences. Stick with us as we go for a quick break. When we come back, I'll introduce the topic to you as well as our guest and then start with the discussion. Please stay tuned. You're welcome back from the break. If you just joined, this is Time with a Specialist Dental Edition on HealthAfrik. And like I mentioned earlier, today we'll be discussing a dental disease that is specifically focused on the gum, and that is periodontitis. And according to the World Health Organization, about 19% of middle-aged adults do face the severe form of the disease, and also people who use tobacco are at high risk. Today, our resident guest is joining us on this episode, she goes by the name Dr. Nana Akonobia Adokwafo from Dr. Martin Carey Dentistry. Hello, Doc.
Hello.
You're welcome once again.
Thank you.
Great. And today we are talking about periodontitis. Someone will ask, what at all is periodontitis? So briefly give us an overview of this disease.
Okay, so periodontitis is basically gum disease. So it's a type of infection that affects the gums.
Okay. And how different is that of gingivitis?
Okay, so basically gingivitis and periodontitis are both gum disease, but they are different stages of the disease.
Oh, okay.
But before I give the differences, I'll give a brief description of the anatomy of the tooth so that we can understand the differences better.
Okay.
So the tooth has a crown, which is the part of the tooth that we see in our mouth.
Okay.
Then it has the roots, which is the part of the tooth we don't see in the mouth. That is beneath the gum.
Okay.
Then around the roots, we have bone and periodontal ligament fibers.
Okay.
Yes. So basically, gingivitis is infection of the gum. So at this stage, it's just the gum that is inflamed. It doesn't go beyond the gum.
Okay.
Yes. But when you talk about periodontitis, the infection has progressed from just affecting the gum to affecting the bone.
Okay.
Yes.
Beneath the gum.
Yeah, beneath the gum.
Interesting. And what are the main causes of the periodontitis?
So the main cause of periodontitis is plaque. And plaque is a film of food debris and mainly bacteria that usually builds up on the teeth.
Okay.
Yes, and buildup of plaque is caused by poor oral hygiene habits, like improper brushing or using the wrong brushing devices, as well as not being able to floss regularly, causes buildup of plaque. And that is like the main cause of
aside
disease.
this main cause, are there other risk factors that is associated to this disease?
Yes, so because it's an infection, there are certain factors that puts you at risk of getting gum disease. So one of it is smoking of cigarettes, smoking of tobacco. Yes, it reduces the immune system and makes it difficult to fight infections.
Okay.
So you realize that you get a whole lot of bacteria coming into play, and it puts you at risk of gum disease. Okay. Yes, also hormonal changes in pregnancy and in menopausal women can put you at risk of getting gum disease.
How is that possible?
Yeah, so during pregnancy, there are a lot of hormonal changes. Yes, so it sort of reduces your immunity.
Okay.
And that is why usually it's advised that pregnant women take very good care of their oral hygiene and also like visit the dentist regularly during the pregnancy period.
Okay. Look, with what you've said, what are some of the symptoms and early signs, warning signs of periodontitis? And also, I would like you to kind of compare it to the stages. You made mention there are stages of the disease. So you mentioned the stages and then the signs or symptoms of them as it progresses. Yeah.
Okay, so the first sign is inflammation of the gums, and that's gingivitis we are talking about. So basically the gum is usually pinkish, but when there's gingivitis, you realize that the gums become swollen and they become reddish as well. Yeah, you have areas you easily bleed sometimes bleeding on brushing, sometimes bleeding on flossing, and sometimes with just like a little trauma to the gum, you end up bleeding. That's basically gingivitis. So at this stage, the bacteria is just within the gum. Then if gingivitis is left untreated, it progresses to periodontitis. And with periodontitis, we have the mild form of it, the moderate form of it, and the severe form of it. So the mild form of it, the bacteria goes below the gum and they create spaces. It causes the gums to move away from the teeth, creating some spaces we call pockets. Yeah, so bacteria gets there, then that's like the mild form of periodontitis. And when these pockets are formed around the teeth, the brush cannot get there. So the bacteria proliferate and they are able to like continue the process. Then you go to the moderate periodontitis. So with that, you have some form of bone loss. Yeah, and at that stage, the bone loss, the teeth may be a bit strong, but not as strong as it's supposed to be. But when you get to the severe stage, then you have like very severe bone loss. At that point, you realize that most of the teeth are shaking in the mouth.
And it leads to the loss of teeth as well.
Yeah, eventually.
Interesting. How aside you losing your teeth, aside the pains, bleeding, and the swollen gum and all that, how would you associate periodontitis to our overall well-being?
Yeah, so with the overall well-being, as periodontitis progresses, the bacteria can go into the bloodstream and they can cause heart diseases, they can cause upper respiratory diseases, they can also cause like preterm birth. Yeah, and also they can worsen diabetes if you have diabetes.
Wow. So it's not just related to the teeth, but when it's not untreated, when it's left untreated, it leads to other disease. Wow, that's quite interesting. Now, moving on, let's talk about the diagnosis of periodontitis. If I'm having all these symptoms or I see the signs and I come to you, how is this disease diagnosed?
Okay, so the first thing is a clinical exam. So we do a clinical exam, then we look for signs of bleeding with just a little trauma. We also look for signs of inflammation. We look at the color of the gum, and also we look at whether there's mouth odor or not, because the plaque buildup can cause mouth odor as well. Aside that, there's something we call probing. So the probe is a bit of a pointed instrument that we run around the gum. It helps us to detect if there are pockets around the gum. Yes, so it's something we do. Aside that, too, we take radiographs. So depending on what we find on examination and what we find on probing, that would inform the type of radiograph we are taking. So the radiograph would help us assess the level of bone loss. And that would help us to determine whether we are dealing with gingivitis or the mild periodontitis or severe or moderate.
And how about the treatment? What are the various treatments available for this disease?
Okay, so the treatment will depend on the stage of the disease. Yes, and also it will depend on the overall oral health of the person and overall well-being of the person. Yes, so basically the treatments can be divided into non-surgical treatments and surgical treatments. So non-surgical treatments are usually for gingivitis and for the mild form of periodontitis. So the non-surgical treatment is dental prophylaxis, which is basically scaling and polishing. And that's usually for gingivitis. So with gingivitis, with the scaling and polishing and good oral hygiene, it can reverse the disease and everything would be fine. Yeah, we also have scaling and root planing for the mild form of periodontitis, because at that point it's gone below the gum. So at this point, a part of the roots may be exposed. Yes, and so at this point we are doing scaling and root planing. In addition to the scaling and root planing and the scaling and polishing, we can give antibiotics if there's a need for it. And the antibiotics could be local antibiotics or they could be systemic antibiotics. Yes. Aside that too, we have the laser therapy. So where they use like laser to try and get rid of bacteria in pockets and dead like tissue and pockets. Yes. Then when you come to the moderate and the severe form of periodontitis, there are surgical interventions. So we have a surgical procedure that helps to eliminate pockets. Yes, we can also do bone grafts if there's a need for it.
Okay.
We can do gum grafts. We can do tissue regeneration as well.
And what is the gum graft, bone graft, and then tissue? Or what is it?
So the bone grafts is basically, so you've lost bone.
Yeah.
So when we assess the situation after scaling and root planing, and it's possible to do a graft to generate bone around the tooth, we do that. Yeah. Then the tissue regeneration. So basically, when there's bone loss, there's basically a space between the root of the teeth and the bone. Yeah, so we sort of put like a tissue there to prevent gum from growing into the place of the bone and give the body time to heal so that bone can be formed. There are times that we do both together. So you do the bone grafts, then you do the tissue regeneration to help at least the area become normal as possible.
Right. Now, before we go for break, still on the treatment option, let's do this practically. Let's say I come to you and then you made mention that at some stage my teeth is going to be weak. It's not going to be strong as it used to be. And so let's say it is very weak, but it is not off. When I come to you, are you firstly going to take off the tooth and then probably fixing artificial, or there's a way you are going to make it stronger? Yes, stronger as it used to be.
So it would depend on the grade of mobility. But whichever way you present with, the first thing is taking away the causative organism, which is the dental plug or the calculus around the teeth. Because sometimes the teeth may appear strong, but they are just being bruised by the calculus, because calculus is hard. So sometimes it's when you take off the calculus that you can really tell the mobility of the tooth. So after doing all of that, together with radiographs and together with the mobility test, you'll be able to grade the mobility, whether it's a grade 1, grade 2, or grade 3. Usually for grade 1, with prophylaxis and cleaning around it and antibiotic therapy, there's some tissue regeneration, and so the tooth is able to become firm. Sometimes when it's grade 2, with that treatment, the mobility can reduce to grade 1, then we continue with some treatments, then it gets to like no mobility. With grade 2 too, sometimes depending on if there are deep pockets, we can do surgeries to eliminate the pockets and do some bone grafts. But usually with grade 3, like the bone is like completely gone. And so usually with grade 3, most of the time, we end up taking out the tooth and giving you artificial.
Great, interesting. We'll go for a quick break. When we come back, we'll continue with the discussion. Please stay tuned. We'll be right back.
Are you a student seeking to pursue a master's degree program but is constrained by location, time, or simply a hectic schedule? Are you a university or college unable to create or digitize your own master's degree programs due to expertise or funding constraints? AAU eLearn Africa LMS has the answer to all your online education needs. Develop your online master's degree programs now at a totally free cost on a platform that is highly customized and secured. The platform's analytic and proctoring feature, calendar with automatic alerts for activities and to-do list, automatic marking of tests in a variety of formats, optional peer review of written assignments, plugin feature, and several more features are only a few of its important functionalities. With the availability of highly skilled and experienced instructional designers and other staff, universities are assured of online degree programs that meet international standards. Online education provides African universities with competitive positioning, scalable access, multiple nodes, multiple modes of communication, virtual collaboration, and a wider selection of programs. Consequently, online master's degree programs have become a viable option for higher education in Africa due to challenges such as infrastructure, graduate output, and lack of funding. Therefore, partnerships and collaboration between enterprises and academic institutions are needed. Admissions are open for the online degrees with Rhodes Business School South Africa and Njala University Sierra Leone. Also, institutions interested in partnering with us to develop their own online master's degree programs should submit an expression of interest. AAU eLearn Africa LMS provides low-cost online master's degree programs to all students and assists universities to digitize their existing master's degree programs as well as help them develop new ones from scratch. For any inquiries and submission of expression of interest, please email us at info@elearnafricalms.com or aaulms@aau.org. Don't miss out on this opportunity for a global and online educational experience.
Thank you for sticking with us. You're welcome back from the break. If you just joined, also today we are discussing periodontitis, one of the common dental disease specifically focused on the gum. And we are doing this with our resident guest, Dr. Nana Akonobia Adequafo. Hello, Doc.
Hello.
Thank you for staying with us. Before we went for break, you made mention of especially talking about the treatment of periodontitis, you made mention that it can be reversed. The damage can be reversed. Yeah, I would like to know what are the chances for this treatment.
Okay, so the reversal will depend on the stage of the disease.
Okay.
So with mild inflammation of the gum and where you just have plaque around the teeth, if your oral hygiene is good at home and you're able to remove the plaque, yeah, it can reverse.
Okay.
Yeah, and also with the mild form of periodontitis, with the professional cleaning and antibiotic therapy, yeah, it can also reverse. Yeah, but usually when you have the severe periodontitis, the chances of reversal, it's very low.
So if you say reverse, it doesn't mean you are coming back to the normal stage, or probably you are coming back but not there. You are not there yet.
Yeah. So for some instances you come back to the normal stage
perfectly,
and for some instances you are close to the normal stage.
Okay. Yes. Also in your submissions, I do hear you saying plaque, calculus. Someone will be asking, what is Dr. Adequafo saying? So if you can explain this plaque and then also the calculus to us, are they the same or they are different?
So there are some differences. So basically plaque is the initial deposit you get around the teeth.
Okay.
So plaque is basically food particles and bacteria. And at that stage, it's very soft. It's like a film coating the teeth.
Like you wake up in the morning, that whitish.
Yeah, that whitish thing that you find on your teeth.
Okay.
Yeah, and that one can easily be taken off with a toothbrush. But let's say the oral hygiene is poor and the plaque remains, you're not able to remove it with toothbrushing. Then there's more deposits of food particles. There's more deposits of bacteria. Then you have calcium and other minerals from saliva incorporating into it. Then it gets to the point where it becomes the yellowish hard material that can't be taken off with a brush unless we take it out at the dental clinic.
And that's the calculus.
Yeah, the calculus.
Wow. All right. Still on the periodontitis, what are some of the practical? You made mention that basically it is poor oral hygiene habits that leads to periodontitis. So what are some of the practical tips for maintaining a healthy gum at home?
Yeah, so first, as we've been singing, brush twice daily, morning and evening, with a fluoride toothpaste. And also when it comes to the toothbrushing, the effectiveness of the toothbrushing depends on the toothbrushing device you are using. So would prefer that you go for the soft bristle toothbrush. Yes, so that you're able to get to areas of the mouth that the hard toothbrush is not able to get to. Yes, and also you have to practice flossing, because basically it's difficult to clean in between the teeth with normal toothbrushing. But as you floss, it takes plaque out of in between your teeth such that it doesn't progress to become hardened like the calculus. And also in between the teeth, that's where usually the pockets form easily. Yes, so you may think you are fine, but there will be bacteria seeping down. And by the time you realize it may be too late. Yes. And aside that, too, you have to incorporate visiting the dentist. So basically, you're supposed to visit the dentist for prophylaxis twice a year, which is every 6 months.
Yeah. Right. And also, I do normally hear that sometimes there are certain types of food you eat that also impact on our oral hygiene. So, are there any dietary recommendations for us to keep a good oral hygiene? Yeah.
Yeah, okay. So first, I would start with reducing the intake of sugar.
Okay.
Yeah, because the sugar serves as sustenance for bacteria. So if already you have gum disease and there's bacteria there, the more intake of sugar, the more like the bacteria gets nourished and they multiply in number. Yes. And also you want to be eating fruits and vegetables and foods that will give you vitamin C, because vitamin C helps to boost the immune system. And so it helps you to be able to fight the bacteria. Yeah, also it makes the gum stronger with collagen synthesis and all of that. Yes, so it's good to take foods with vitamin C. Also, probiotics like yogurts also help reduce the population of bacteria in the mouth. So you want to go in for those foods.
Interesting. And when you made mention of the vitamin C, I quite remember as a teenager when I brushed my teeth and I start to bleed, my mom would rush and go and get orange. I don't know how it works, but then after taking the orange, the bleeding stops, and then even the full subsequent times when I brush, I don't see the bleeding. What was this? What's the linkage on
Yeah,
that?
so it's how vitamin C works. So basically, vitamin C is good for wound healing.
Okay.
Yeah, and it uses like different techniques, like the synthesis of collagen. Yes, so the periodontitis or the gum disease is basically like this a defect in the gum. So the vitamin C helps with the healing process.
Right. I know you've already made mention of this, but probably someone will be joining us soon. And I want us to stress on that. When we leave periodontitis untreated, what are the consequences of this? I want us to stress on it.
Okay, so when you leave periodontitis untreated, it gives you bad breath, then you can lose your teeth. Then aside, when it comes to the overall well-being of the patients, the bacteria can spread to other areas of the body, and commonly it causes like heart conditions. You can also have preterm birth, yeah, and it can also worsen diabetes if you're diabetic.
Okay. Well, that is all for this episode. Before we go, what's your final words to our audience?
Well, so all I would say is you should incorporate visiting the dentist every 6 months into your lifestyle, because basically you need to do cleaning every 6 months to make sure that you are getting rid of plaque and calculus, to ensure that you do not develop gum disease or it doesn't progress to periodontitis.
Okay. Thank you very much, Doc, for joining us, and we hope to meet you again in our next episode. And that is all for this episode. If you just joined, this is Time with a Specialist Dental Edition on HealthAfrik, and we've been doing this with Dr. Nana Akonobia Adokwafu. According to her, periodontitis is not only focused on the gum, but then if it is untreated, it can lead to other health disease. So it is important we all keep a good oral hygiene habit. Thank you for joining us. My name is Isabella Teta Hinakwa. See you again in our next episode. Have a nice day.